katika hospitali kuu ya rufaa ya Kenyatta. Tusikize tangazo la Mkenya wa kwanza kupokea chanjo hii ya korona. Twende kule moja kwa moja.
No further cost. So there's no cost to Kenyans or to the Kenyan government for this vaccine, and all COVAX vaccine will be delivered. Clearly there's still cost to the Kenyan government in the delivery of the vaccine, in the salary of the health workers, in the maintaining of the cold stores. But the vaccine itself and the injections will be given freely. I would at this point like to thank the donors of the COVAX facility. Their support is greatly appreciated. The vaccines will initially protect only those that are vaccinated. It will take a long time before herd immunity can be established. While the vaccines will initially protect the health workers and essential staff and then the most vulnerable people in the society, many Kenyans will initially be not vaccinated, at least initially. It is therefore essential that all understand that even with the arrival of these vaccines, we cannot let our guard down. We need to continue to wear our masks in all settings. We need to continue to avoid congested public or large gatherings, including large political and social gatherings, as these can potentially cause the virus to spread more rapidly. And we need to practice hand washing and increased sanitation and all those measures that the government have put in place. With the arrival of these vaccines in Kenya, we have now turned a corner and can say that we are on the road to ultimately recover from this pandemic. We encourage all that have access to these vaccines to get their shots as soon as possible to protect themselves adequately. And again, we call on all to maintain the public health measures required to avoid ongoing transmission, spread, disease, and even death. Madam PS, from WHO, we are honoured and delighted to work with you to get these vaccines to those that have to be protected quickly. We are proud to work with UNICEF and the other COVAX partners to start addressing vaccine equity, making sure this means the protection reaches all countries across the world. Thank you.
Thank you very much for those kind remarks and information. The next person to give some statements is Chairperson and Representative of COVID Task Force, my brother, Dr. Gitai.
Colleagues, ladies and gentlemen, good morning. Madam PS, Director General Patrick Omoth, the CEO Kenyatta and the Chair, who is here with us as well, the development partners, WHO, Rudy, Maniza from UNICEF, all of us and the members of the fourth estate who've been very, very, very instrumental in fighting this pandemic. I stand here on the behalf of the Chair of the National Vaccine, COVID-19 Vaccine Deployment and Vaccination Task Force, Dr. Willie Sakwale, who's been chairing this task force. And our key mandate was to rapidly and in a scalable way deliver a vaccine that is safe and effective and accessible to all Kenyans, irrespective of their ability to afford it. And we have worked and we continue to work to this moment, to work extremely hard through multiple subcommittees to ensure that this moment gets here, but also very cognizant that this moment is only a start to the journey and not the end of it. So as we see all of us celebrating here the launch and also the vaccination of the index vaccinee, it is only, we must remember that the journey has only started. The many days, the many nights, the many weekdays, the many weekends that the task force has spent to ensure this moment happens will only need to be doubled and tripled and quadrupled to ensure that we don't stop until every deserving Kenyan or every Kenyan who is at risk or every Kenyan who deserves to get the vaccine does actually receive that. As representing the National Task Force, which reports to the National Steering Committee, I would like to thank the government represented here by the PS, the Ministry of Health, which has been extremely supportive to the task force. and partners who've been very supportive, like WHO, UNICEF, CHAI, who've actually also facilitated our meetings and our getting together, and also all the members of the national and the county governments who participated in this process. For your information, I just need to mention to you the number of committees that we have so that you see that this has been a very well-planned and continues to be a very well-planned process. For one, we have a subcommittee on planning and coordination, which is headed by one of us, and that is looking at how does this deployment plan reflect both national and county and local needs, so that the coordination is both national and county governments. Secondly, how does it reflect the support available from development partners, that's input. So the deployment plan has been shared with stakeholders from development partners, private sector, county governments, health workers. We've shared it also with the church-based organizations. We've shared it with private hospitals to ensure that it is robust enough and reflects everyone's needs. There is also a committee on training and capacity building, which is headed by Dr. Richard Ayer, which has been looking at how do you ensure that the administration of this vaccine continues to follow safe vaccine administration processes. Because, ladies and gentlemen, remember, this is not the first vaccine that Kenya is administering. Kenya and many other countries have been administering vaccines time immemorial. So it's not the first one. It's not the first to discuss the challenges you've discussed. It's not the first to discuss allergies and who desires it and who deserves it. It's not the first to discuss the age of criteria of entry. It is just one of the many vaccines that we offer. But of course, this one pays special attention because of the pandemic. So there is a training and capacity building to ensure all health workers who are going to administer these vaccines are well trained and understand safe administration. We have a vaccine financing, costing and resourcing subcommittee, which has been looking at resourcing, and we are really grateful to the COVAX facility for ensuring that Kenya actually receives vaccines of the volumes we are seeing. We expect that we'll get more in a few weeks and more in a few weeks until we can actually meet the demand. And of course, the Kenya government is going to commit also to ensure that no Kenyan is left behind, also with domestic resources as well, and I'm sure the PS will comment on that. We have a subcommittee on procurement logistics. You saw when the vaccines arrived, they were very well taken care of, safely delivered to the national depot, and they're going to be leaving the national depot to go to the 8 depots across the country. Again, that is not an easy task. We may take it for granted. It is no easy task at all. We then have a subcommittee for data management, monitoring, and surveillance, that every individual who receives the vaccine will need to be registered because that data is important. Now, that data is not only for COVID. We collect data for every child who receives vaccination. So data collection is not something we need to see as a COVID-19 issue. So data collection, data management, monitoring, and surveillance is a subcommittee. Then we have 2 more subcommittees, one for advocacy and communications and community mobilization, because we all know that without engaging the communities, we are going to have a challenge with acceptances, and we have put resources in place to engage the community members so that, as has been said before, they understand the vaccine is safe and effective in managing this pandemic, including together with other measures that we've been advised until we can reach a point where we know now that an adequate number of the population is immunized. And finally, we have a subcommittee which is critically important, regulatory and vaccine safety, which ensures that regulatory processes and the release of vaccines has been checked, and that has been chaired by the Pharmacy and Poisons Board. Thank you, ladies and gentlemen, on behalf of the task force. Thank you.
Thank you, Daktari. The next person is UN Resident Coordinator, Dr. Stephen.
PS Mochache, DG Dr. Amoth, Mr. Amuri, CEO of Kenyatta Hospital, my dear friends Rudy and Maniza, the representatives of WHO and of UNICEF, dear friends. Many congratulations today on behalf of the entire United Nations system on this momentous occasion. It's just a couple of days since I had the honor of presenting my credentials as the new United Nations resident coordinator in Kenya. I'm deeply honored to have been designated as resident coordinator, but I'm even more honored and moved by the symbolism that this launch of the COVID-19 vaccination campaign in the Republic of Kenya should be my first opportunity to address public remarks. We've seen a resolute response in Kenya to the scourge of the COVID pandemic, but there's been much sacrifice by Kenya's people. More than 1,800 deaths. And first and foremost, we honor their memory today, and we hold them and those that have lost them in our thoughts. But today we see the first glimmer of the light at the end of the tunnel, with these first 1 million doses of the COVID vaccine arriving in Kenya from the COVAX facility. And this is part of 10 million doses that have already been distributed globally by the COVAX facility to 15 countries. And Kenya is amongst the very first of those countries here in Africa. Friends, the Secretary General of the United Nations, Antonio Guterres, recently said of global vaccine distribution, he said, "It is wildly uneven and wildly unfair." He said that just 2 weeks ago. I would add that the way that the planet is handling the distribution of vaccines overall is also wildly unwise, because it is in the interests of everybody on the planet that everybody should be vaccinated. If we don't do that, then the virus has places to hide and grow. And so it is that this COVAX facility was established precisely, as Rudy has already said, to redress this unjust and unwise imbalance, this global inequity, to ensure that safe, effective COVID-19 vaccines are rapidly available and affordable to all countries and all people around the world, regardless of income level. The Global Vaccine Initiative, CEPI, WHO, UNICEF are all key partners in this COVAX facility. Yesterday, in his address to us at State House, to the entire diplomatic corps in Kenya that I had the honor to attend, His Excellency the President thanked the United Nations and its member countries for their support to Kenya during this unprecedented crisis. Permit me then to add my voice, to thank the many donors and partners, including the United States, Japan, Saudi Arabia, European Union, Canada, the United Kingdom, plus foundations and companies, including the Bill and Melinda Gates Foundation, all of whom have supported this COVAX facility in different ways. And let me once again thank UNICEF and WHO for their part in this vaccine launch, and the many UN entities that have been helping Kenya weather this unprecedented storm that is COVID. Friends, vaccination is voluntary. It is not obligatory. But let me reassure all Kenyans that I have absolute confidence in the vaccine's safety and in its urgency, its importance, its necessity. I and my family will be vaccinated when it comes to be our turn. But we will wait our turn until all of those on the front lines and those who have the most exposure to this dreaded virus receive the vaccine and have benefited. Because it is to our frontline workers in the health sector and in allied fields that we all owe the deepest debt. On behalf of the entire United Nations system, I thank them once again. In closing, P.S., permit me also to underline that if today we see some light at the end of the tunnel, as I've said, we're not yet at the exit of the tunnel. We must not drop our guard. We must continue to practice the hygiene measures that we have learned to trust, keeping a safe distance from each other, wearing our masks, washing and disinfecting our hands. That will keep us safe. And we must all avoid fake news. There's too much fake news about COVID. Please listen only to trusted, verified sources. The Ministry of Health, the WHO, UNICEF, the United Nations. These should remain your trusted friends for advice on how together we can defeat this treacherous virus. I'm going to take one last risk, PS friends, by trying with my terrible Mzungu pronunciation a Kiswahili proverb that I think is particularly appropriate. Baada ya dhiki faraja. Baada ya dhiki faraja. I guess I got it right. After hardship comes relief. And that relief begins today. Asante sana, and many congratulations.
Thank you, Stephen. I will call the chair to welcome you and invite the DG, who will also now invite the Madam PS.
Thank you, Madam PS, Madam Mochache, DG, Dr. Amoth, representative from World Health Organization and UNICEF partners. We are very happy here at Kenyatta, and this is a big day for the health workers here. So we are really, really happy on this occasion, and we say thank you. And let me invite the DG to say a few words, and then invite the PS, Asanteni. And
thank you, Chair. Our chief guest, the Principal Secretary, Minister of Health, Madam Susan Mochache, the UN representative, Dr. Jackson, WHO representative, UNICEF representative, the chair of the task force, chair of KNH, Board of Management, CEO, the great health workers of this great institution. Ladies and gentlemen, good afternoon. Mine will be very, very brief, because if I talk more, I will just simply be repeating what the other speakers have said. Today is a momentous occasion for us as a country and as a people, because today we are going to launch one of the most important tools in combating the COVID-19 pandemic, the launch of the vaccination program for COVID-19. It has been a long, tortuous journey from March of last year, when we recorded our first case. We have had numerous challenges, but we have also recorded significant achievements during our fight of this pandemic. We have done this together as a whole government, as a whole society, as a people, faced with one common enemy. Today, I just want to address the healthcare workers, assure you of the safety of the vaccine, because the vaccine has undergone a rigorous and a robust process before its registration. And we are also learning, because we are coming 3 months after the launch of these vaccines in the high-income countries, lessons that they have gone through when they commenced their vaccination process. I assure you that the vaccine is safe, and of course it will be offered for free to all Kenyans, especially the vaccines that we are going to get from the COVAX facility, and also the vaccines that we are going to procure through public funds. And the only way to testify that this vaccine is safe is that ourselves will be able to offer ourselves for vaccination today in your presence. I also want to appeal to you to go out there and be good ambassadors of conveying the right information regarding the COVID-19 vaccines and other measures that we have continued to articulate before. The vaccine is an important public health tool, but it is not the only tool. We still need to continue with other public health social measures, which are somehow enable us to control the infection to some degree. So going forward with this additional arsenal, we only hope that things will get better, and we will go to normal or near normal if we have a significant proportion of our people vaccinated. Please, let's convey the correct information to the public, including our friends from the Fourth Estate, the media, so that we only speak the truth, nothing but the truth. We have also put measures in place to ensure that we have what we call pharmacovigilance as we go out to be able to carry out the vaccination process at the county level, which will commence next week, because yesterday, after the official flag off by HE, the President, The vaccines have reached the regional depots, the 9 regional depots, and are on their way to the county referral hospitals, where a similar activity will take place next week. So our pharmacovigilance system will be able to monitor for any adverse reactions to the vaccine. Just as had been said by the previous speakers, this is not the first vaccine we are introducing. In the past 10 years, we have introduced, I think this is the 10th antigen in the past 10 years. So literally that works to approximately 1 antigen per year. So we have a degree of comfort that the healthcare workers have the necessary skills and the necessary expertise to be able to administer the vaccine and ensure protection of all Kenyans. The reason we started with healthcare workers is because they are high risk of exposure, and it's also because they play a critical role, because if you fall sick and the healthcare worker is also sick, who is going to take care of you? We need essential services to continue running uninterrupted. And in our first approach, we are comfortable and we sure that eventually we shall be able to reach everybody who requires to be vaccinated. With those few remarks, it is now my honor and pleasure to invite our chief guest, the Principal Secretary, to make her brief remarks and officially launch the national vaccination campaign. Madam, yes.
The representatives of the development partners who are represented here, the Director General of Health, the CEO of Kenyatta, as well as the Chairman of Kenyatta, all our health workers, members of the Fourth Estate, ladies and gentlemen, good afternoon. Good afternoon. First and foremost, I wish to take this opportunity to thank you all most sincerely for honoring our invitation today to witness the launch of Kenya's COVID-19 vaccination campaign. This campaign is but one of our multiple arsenals against the COVID-19 pandemic that has interrupted our way of living. Indeed, it is a proud moment for our country, being among the first on the continent to receive and commence a COVID-19 program. Ladies and gentlemen, as you are all aware, yesterday, His Excellency the President, Uhuru Kenyatta, officially flagged off the countrywide distribution of the COVID-19 vaccines at our national vaccine stores in Kitale. Kitengela, I'm sorry. This means once we officially launch the campaign today, the vaccination exercise will commence in all our county referral hospitals, since the vaccines have also been moved there. We at the Ministry of Health and the entire government as well are not taking any chances with the lives of our people. It is, however, important to note that the demand for the vaccine globally has necessitated a phased approach in its deployment. Thus, our reason for being here today. This phase targets our health workers across the country who have worked tirelessly for the past 1 year, some even making the ultimate sacrifice by being our first line of defense and caring for those suffering from COVID-19. It is our responsibility as a government and as a society to ensure that these essential workers get full support and are well protected as they dispense their duties. I therefore wish to urge and encourage all our health workers to get vaccinated. As we launch our vaccination exercise today, you will witness that the Ministry of Health is employing a data management and reporting electronic vaccine registry, the Chanjo Management Information System, which was developed together with our experts from the Ministry of ICT and Youth Affairs. The system will enable the Ministry of Health in vaccine traceability, thus ensuring that our stocks are professionally managed. It will track and manage vaccination schedules. It will help in the reporting and addressing of any adverse effects, and it will finally provide us with the reliable reports that we require for decision making and for policy. This is in keeping with the global standards for vaccination, distribution, administration, and monitoring. Ladies and gentlemen, for the success of this campaign, we urge all the stakeholders, especially our fourth estate, as has been urged by others, that you have the ear of the nation to assist us in disseminating the right, and I repeat, the right information to our citizens. This is a life-saving intervention. This may mark the beginning of the end of the pandemic. It is in our best interest to heed the recommendations that are made by the Ministry of Health and channel our concerns through the right mechanisms. We continue to encourage the adherence of the containment measures, as you have heard from everybody who has had a chance to speak here. We must continue to wash our hands. We must continue to sanitize, wearing our masks and social distance, as these remain our best weapons against the disease. Ladies and gentlemen, let me take this opportunity to sincerely thank our development partners, WHO, UNICEF, AMREF, Red Cross, the Clinton Health Association, and many others who have been integral in the realization of this campaign. I also wish to appreciate the COVID-19 vaccine task force, with members that were drawn from the different multi-stakeholders from the health sector, including the county governments, who have worked tirelessly to make this campaign a success. It is a historic moment for us to stand here at the Kenyatta National Hospital, our largest national referral hospital, and a front runner in the management of COVID-19 for this very important exercise. I therefore want to congratulate and thank all the health workers for all the good work that they have been doing and which they are still tirelessly devoting their all to do, and for the sacrifices that they continue to make to ensure that we are all as safe as we could possibly be. Hongera, hongera sana. With these few remarks, and on behalf of the government and the Ministry of Health, I now wish to officially launch the COVID-19 vaccination campaign. Asanteni sana. Mungu awabariki. Haya, wenzetu ambao mmejumuika nasi siku ya leo, tungependa kuwashukuru kwa kuwa hapa kusherekea siku hii na kuweza kuwa witnesses wa siku hii ambayo ni ya muhimu sana kwa nchi yetu katika vita dhidi ya COVID-19. Hakika kama mjuavyo, tumekuwa na ugonjwa huu nchini karibu mwaka mmoja sasa, na tumeweza kujaribu vile tuwezavyo kupigana na vita hivi. Na leo tumeweza kuwa kati ya nchi zile chache duniani ambazo zimeweza kupata chanjo hii. Kenya nafikiri ndio tuko nambari ya pili au ya tatu kuanza kupeana chanjo kwa wananchi wake. Na kama ilivyosemwa hapo mbeleni, chanjo itaanza kwa wale ambao wako, yani frontline workers, wale ambao wanafanya kazi mahospitalini, wauguzi, madaktari, mtu yoyote ambayo waka katika hospitali na yuko katika yani ile exposure anaweza kupata ugonjwa huu. Kwa hivyo tutaanza leo kuona vile ambavyo tutaweza kuanzisha mradi huo wa kupeana chanjo hii kwa wafanyakazi wetu wote katika sekta ya afya. Na kwa hayo machache ningependa pia kuongezea kusema baada ya leo chanjo itaanza katika sehemu zote za nchi yetu ya Kenya. Tunajua kwamba teething problems hazitakosa, kutakuwa na tashwishi kidogo tunapoanza, lakini tumeweka mikakati ya kuhakikisha kwamba kaunti zote zitapata vaccine. Labda kesho zingine zitakuwa zimefika katika kaunti ambazo ziko mbali sana, na kwa hivyo wale ambao wamepata vaccine wanaweza kuanza kupeana hiyo chanjo, na tukishamaliza na wale ambao wako wanafanya katika sekta ya afya, tutaweza kuangalia wale ambao wako katika sekta ya mafunzo, walimu, alafu tuangalie pia wale ambao wako katika sekta ya ulinzi, askari wetu ambao wanafanya prisons, magereza. Hawa wote tutaweza kuwafikia, na baada ya mwezi wa 5 tutaanza sasa kuangazia wale ambao wamefika miaka 50 kwenda juu na wale ambao wana ugonjwa mwilini ambao inabidi wapewe chanjo ili ugonjwa huu wa COVID usiwaangamize. Kwa hivyo leo ni siku ya muhimu kwa sababu tumezindua chanjo katika nchi yetu ya Kenya, tukimshukuru rais wetu ambaye amekuwa kipaumbele kupeana mwelekeo, na wizara katika waziri katika wizara ya afya ambao pia ametoa uongozi ambao umetuwezesha sisi wote kuwa pamoja na kuweza kushinda vita hivi na kuendelea kukabiliana na vita hivi. Kwa hivyo, kwa hayo machache ningependa kuwashukuru. Sasa tunaenda kutoa chanjo ya kwanza ambayo tutaitoa kwa Director General wa Wizara ya Afya akiwa Health Worker number 001. Sisi wengine tutafuata wakati ambapo wote ambao wanafanya katika mahospitalini wameweza kuchanjwa, alafu tutaenda kuchanja wengine. Asanteni sana.
Now the vaccine will be handed over to me.
Mtazamaji, ni tangazo rasmi ambalo limetolewa pale na Daktari Susan Mochache ambaye ni katibu katika Wizara ya Afya. Tunatarajia labda kupata ile picha moja kwa moja ambayo chanjo ya kwanza kabisa imetangaza itakuwa inapeanwa kwa mkurugenzi mkuu katika Wizara ya Afya, Daktari Patrick Kamoth, ambaye amemuita kama mhudumu wa afya nambari 1 ambaye atakuwa anapatiwa pale katika hospitali ya Kenyatta. Lakini baadhi ya masuala ambayo ameyataja katika uzinduzi rasmi wa kampeni ya chanjo hii ya korona ni kuundwa kwa ule mfumo dijitali ambao ameitaja kama Chanjo Management Information System, ili kuangalia usambazaji na vile vile idadi ya chanjo zinavyopeanwa kwa Wakenya. Mbali na mfumo huo dijitali wa Chanjo Management System, vile vile kuna kamati ya usalama ya chanjo ambayo imebuniwa na itakuwa inasimamiwa na bodi ya wanafamasia nchini, ambayo itakuwa inaangalia vile vile usambazaji na usalama wa chanjo hii katika mabohari ama depo zote 9 kote nchini, baada ya kuzinduliwa jana ule usambazaji wake na Rais Uhuru Kenyatta katika ile hifadhi kuu ya kitaifa ya Kitengela. Alilotangaza vile vile